kidney, and you see the renal pelvis are very close to the midline, it's important to make sure that it's not pushy. So, when you measure in your report, do not measure the kidneys like so. This is not the way to measure. It's yes, how you strike, how you actually see that there is renal pelvis dilatation. You look at this image. Yes, I can see it, but you have to go into an axial section. And so in the axial section, you then take the measure. The cutoff the first trimester of pregnancy is a cutoff of 2 millimeters. So if you look at this baby, you can tell straight away that there's renal pelvis dilatation on both sides. And I don't think there's a horseshoe kidney. I think both kidneys are separate, but important to measure in the correct plane is the point that I'm making. Yeah. And the other thing, which I can try, just because it's not your vagina, and we can try and kind of dominate it. And when you're trying to do a 4D analysis of the baby's heart in the first semester of pregnancy, and you can try also to do this abdominal approach. So if I take the 4 chambers and down to the 4 chamber of the heart, so I go to the cardiac preset, then I magnify the image of the heart, then I put on my cardiac output setting, and I set my PRF at 25, I increase my acoustic output and increase my gain. I then magnify my image and select 4D, at position 15, then 15 degrees. And then I just hope, say a prayer, the baby stays. And then I open up my section with stop breathing. 5, 4, 3, 2, 1. And I save that image to 5, 4D, and then I just repeat one more image of that. Just take it again. And just before I hit the back to 2D, just for a second, I'm just going to magnify the image, and I just want to fix my settings. So I'm going to reduce my PRF very slightly. Again, and just increase my output. I want a little bit more gain, a little bit more color, and just get my settings right. And then go to 4D. 5, 4, 3, 2, 1. So I'll just say 2 quick volumes in assessing the baby. And if I go back to the very first volume, and you can decide that you've got a good volume, you go to multiplayer, you go to full screen, and then you run your clip. And as you run your clip, you can then change to DCI. And when you got on DCI, then you can change your settings to ICE. And then you go down and change your kind of speed, take it down to 50% and make it straight. There's the main pulmonary artery coming out, and then you can down, that's your single ventricle fill. And if you want to, you can then put these side by side. This is your rendered image. So when you look at your rendered image, this is your, here shows you your right ventricle. This is your right ventricular fill. This is your right atrium, point 2. And this is the main pulmonary artery here. And this is the arterial duct here. So that's showing you a rendered image of the baby's heart, a very complex heart abnormality. You can choose to take your region of interest, and you can open your region of interest wider. You can make it larger, and then run your simulative again. So that's a hypoplastic left heart, dilation main pulmonary artery, with reversible flow, to show you how to do a stick volume analysis. So it's a transabdominal image. It's okay, but the stick volume images will always be better transvaginal.
thôi.
Đấy là của Dân Solution này, của Evolution này. Chị làm không ra đi phải. Không phải, cái này là tại vì bây giờ ở ngoài đầu chỗ hội trường này thì
Mình mua từ công ty
tài liệu của thầy thì có chuyện không?